I'm Mindy.
And I'm Ed.
And we're Adventures in Raising Grands, the Lowdown. Please be sure to like and subscribe and to share this channel. Someone you know may need to hear this. Tonight we're going to be talking about childhood trauma. Childhood refers to children from the ages 0 to 6. And the definition of trauma is a psychological, emotional response to an event or an experience that is deeply disturbing or distressing. One that often repeats or goes on for a long period of time, such as a loss of a loved one, an accident, an illness, abuse, rape, or torture, or abandonment. The reason for such a broad definition is because traumatic events are subjectively viewed. People process things differently. And because of this, psychologists have decided to put it into categories. There are 3 main categories of trauma. The first category is called complex trauma. This is where the trauma has been repeated and it resulted in harm. The second type of trauma is called PTSD, or post-traumatic stress disorder. We've talked about this in one of our earlier videos. Please, if you have not seen that, go back and watch it. There's lots of good information. This is the most common diagnosis, and it is an exposure to intense physical harm and can have persistent, frightening thoughts. The third category is called developmental trauma disorder. And this is usually formed during the first 3 years of the child's life because of abuse, neglect, or abandonment. Childhood trauma interferes with neurological, cognitive, and psychological development. The symptoms of trauma are as follows, but not limited to: memory problems, anger, difficulty learning, poor verbal skills, flashbacks, sadness, despair, hopelessness, developmental delays, unpredictable emotions, very moody, feeling guilty, shameful, isolation, they feel helpless, and physically they can have headaches and stomach aches, and actually any aches in their body when there's no other cause for it to be. Because children under the age of 6 have a hard time verbalizing, many people say that they were not affected. I can't tell you how many times I've heard how lucky we are that ours are so young that they won't remember or won't be affected. But this is so wrong. It's worse because these children are developing, and while their brain is developing and they're going through trauma, it causes the cortex not to develop fully. And the cortex is in charge of the children's memory, attention, perception, awareness, thinking, language, IQ, consciousness, and the regulation of emotions. When looking at our grands, after reading that, I realize that they do have many of those symptoms. How many of you out there have children that have been diagnosed with ADHD or ADD, or maybe they're nonverbal and have behavior problems or a lack of impulse control? These are because that cortex was damaged. They may find ways to get attention in negative ways. They may have severe behavior problems or regressive behaviors or even aggressive behaviors. They may imitate the abuser or reenact the event that happened. They may startle easily. They may have a fear of adults, especially adults who look like the abuser, or may have a fear of certain places that remind them of the trauma. Are you nodding your head? Are you making check marks mentally and realizing that your child or children have many of these things? I know I am. I see a lot of these characteristics in our grands. Let's continue. Separation anxiety, lack of empathy, increased medical problems, anxious, irritable, withdrawn, a lack of confidence, poor appetite, overeating, hoarding, food and other things as well. Poor sleep habits, not sleeping through the night, wetting the bed, nightmares, and night terrors. It's common for them to have many of these symptoms, and not all children will have all symptoms, but most children will have some symptoms, depending on how long they were exposed as well as how old they were and at what stage of development that they were exposed to the trauma.
5 seconds.
Diagnoses in trauma are not always given immediately, especially in preverbal children. Trauma assessments are not normally done immediately after the event. Normally, the assessments are not given until the behaviors start. But once the behaviors begin to show, it's too late for some. The behaviors can start at any time after the event, from one day to years later. Now, many educational communities and programs are assessing children early on to help for early intervention. Assessing the children with questions during an intake, they're hoping to identify children who have suffered the traumatic events, because early intervention is so important. It allows for a happier and a healthier life for the child. Physical diagnoses of trauma include diseases like heart disease, diabetes, substance abuse, intestinal issues. Also, this will follow them all the way to adulthood, and they could get new diagnoses at any time. This is why early intervention is the key. I've become sort of a detective. I'm constantly watching for clues and new signs from our grands, hoping to bite anything in the butt so that we can get the early interventions and the therapies that they need to minimize the effects on our grands. The treatment to childhood trauma includes cognitive behavior therapy. There are many types of cognitive behavior therapy. I'd like to mention a few. Multiple modality, which is hard for me to say, trauma treatment, usually referred to as MMTT, which makes it much easier. Another type is trauma-fused cognitive behavior therapy, Stanford Q-centered therapy, as well as trauma affect regulation education therapy. These therapies all use very similar and yet different strategies for helping the children. But for the most part, they all use these similar ones. Writing narratives, which would be writing about the trauma, as using themselves as a narrative, as writing the story. Cognitive restructuring, learning coping skills, empowerment, learning relaxation techniques, effective expressions, enhanced safety, defining goals, and teaching them how the trauma has affected them so that they know how to respond. Because I'm not a therapist, I can't go into much detail on how exactly these work. I just know that it's very important for anyone that suffers trauma to get help, to make sure that you have a therapist that you like, you get along with, and understands you. Please get help. Now it's time for the Adventure Challenge. This is when we challenge you to take photos of your grands doing something special, and sometimes something that's not so special. Just the everyday things. Please send the photos to us. Our email is located at the end of this video. This week's challenge is showing pictures of your grands enjoying the weather. Now, where we live, the weather's beautiful and sunny, but I bet someone out there has some beautiful snowy weather to send us pictures of some snowmen. Here are some photos of our grands doing the challenge. Thanks for watching this episode of The Lowdown. Be sure to like, subscribe, and share this channel. Someone you know may need to see this. Stay tuned for our next episode on The Lowdown. Don't forget to send in those photos.